Prostate cancer is the most common cancer in men in the United States. It's the second most common cause of cancer death in men in the United States. So, despite everything we might hear and read about it being very common, not necessarily needing to be found or treated, the flip side of the coin is that when it exists, we better make sure we're not dealing with a serious case because it can be life-threatening. Fortunately for patients, there are a lot of available resources and there are a lot of available effective treatments. One approach is to just watch the patient. It's called watchful waiting. Another approach is to cure the cancer with either surgery, radiation, or other modalities. Sometimes we have a patient with prostate cancer whose disease is advanced and we need to really think not about curing the cancer, but controlling the cancer. The standard treatment for prostate cancer involves what's called external beam radiation, and there are a lot of different trade names or whatever for this. Modern radiation is delivered utilizing what's called three-dimensional conformal treatments. Three-dimensional conformal treatment is basically utilizing a computer to recreate a three-dimensional model of the patient, one that's accurate anatomically, and then designing the radiation that takes into consideration the anatomy and protects the parts that don't need radiation and targets the tumor and the high-risk areas. The next evolution beyond three-dimensional radiation is the intensity modulated radiation, which cuts it into little pixels, so to speak, and allows you to be much more accurate in terms of the distribution of the radiation dose. And now we use what's called image guidance to help us make sure that we're on target every day. Another way to treat prostate cancer is to use what are known as radioactive seeds. And radioactive seeds essentially give the radiation from the inside out instead of from the outside in, like with the machine. The nice thing about that is the whole procedure takes 2 hours and you go home the same day and you're done. The radioactive seed implants are a wonderful treatment for the right guy. Just like any of these treatments for prostate cancer, the ones that have high success rates for 2 reasons. One is they're done correctly and done well by an experienced team. The second is that you don't do it on somebody who shouldn't have it done. And there are some men who are not suitable for one form of treatment or another. And that, again, is really part of the discussion and the consultation amongst the team members who are involved in that patient's management.